Foundations of Homeopathy and Biochemic Tissue Salts. This video is property of Ravsar. The philosophy of homeopathy. Goal: understand the core laws that govern homeopathic medicine. What is homeopathy? Homeopathy is a system of natural medicine introduced by the German physician Samuel Hahnemann in the late 18th century. It treats the individual as a whole, holistic, rather than focusing solely on a diseased part. The three pillars. 1. The law of similars, similia similibus curantur. Like cures like. A substance that causes symptoms in a healthy person can cure those same symptoms in a sick person. Example: peeling an onion causes watery eyes and a runny nose. The homeopathic remedy allium cepa, made from red onion, is used to treat hay fever with those exact symptoms. 1. The law of infinitesimals, the minimum dose. Remedies are diluted to the point where often no physical molecules of the original substance remain. Homeopaths believe this removes toxicity while enhancing the substance's energetic healing potential. 1. Potentization. The specific process of preparing remedies involving serial dilution and vigorous shaking, succussion. Introduction to tissue salts. Biochemistry. Goal: distinguish between classical homeopathy and biochemic therapy. The biochemic theory. While based on homeopathic preparation, tissue salts, also called cell salts, were developed by Dr. Wilhelm Schussler in the 19th century. Schussler theorized that disease is caused by a deficiency of vital inorganic minerals in the cells, not just an energetic imbalance. Key differences. Feature: classical homeopathy. Primary goal: trigger the body's vital force to heal itself. Tissue salts, biochemistry. Primary goal: replenish cellular mineral deficiencies. Selection: classical, based on unique symptom pictures, mental and physical. Tissue salts, based on physical symptoms and signs of deficiency. Potency: classical, ranges widely, 6C, 30C, 200C, 1M, etc. Tissue salts, low potency, usually 3x, 6x, or 12x, to ensure absorption. Scope: classical, thousands of remedies. Tissue salts, 12 specific mineral salts. The 12 Schussler tissue salts. Goal: master the indications for the 12 primary mineral salts. Schussler identified 12 inorganic minerals present in every human cell. These are numbered 112 and are the core of this therapy. The must-know chart: 1. Calc fluor, calcium fluoride elasticity. Varicose veins, hemorrhoids, cracked skin, weak tooth enamel. 2. Calcphos, calcium phosphate, growth and restoration. Growing pains, fractures, anemia, poor digestion, restorative tonic. 3. Calc-sulf, calcium sulfate, the blood purifier. Acne, abscesses, slow-healing wounds, yellow discharge. 4. Ferrum-phos iron phosphate, first aid. First stage of inflammation, fever, sore throat, bleeding, anemia. 5. Kali-Mur potassium chloride decongestant. Second stage of inflammation, white mucus, ear infections, swollen glands. 6. Kali-Phos, potassium phosphate nerve nutrient. Stress, anxiety, brain fog, insomnia, nervous exhaustion. 7. Kali-Sulf potassium sulfate skin and oxygen, chronic inflammation, yellow slimy tongue, dandruff, shifting pains. 8. Mag-Phos magnesium phosphate, the antispasmodic. Muscle cramps, menstrual cramps, shooting pains, sciatica. 9. Natmur sodium chloride water balance, dryness versus edema, watery runny nose, grief, emotional suppression, cold sores. 10. Nat-Phos sodium phosphate acid neutralizer, heartburn, acidity, gout, stiff joints, worms. 11. Nat-Sulf sodium sulfate water eliminator, liver support, biliousness, humidity, aggravate symptoms, head injuries. 12. Silicia silica the cleanser, expelling foreign bodies, splinters, brittle hair, nails, boils, blocked tear ducts. Pro tip: Bioplasma is a common combination remedy that contains all 12 salts in one tablet, often used as a general tonic. Application and dosage goal: Learn how to administer these remedies safely. How to take. Sublingual. Tablets are usually lactose-based and should be dissolved under the tongue for rapid absorption into the bloodstream. Mag-Phos. Hot sip. For cramps, menstrual or muscle. Dissolve 5 to 10 tablets of Mag-Phos in hot water and sip slowly. This is known to act faster than dry tablets. Dosage guidelines. Acute, sudden onset. Take 1 dose, 2 to 4 pills, every 30 minutes until relief is felt. Chronic, long-term. Take 1 dose 3 times daily. Safety. Tissue salts are generally considered safe for children, pets, and the elderly, as they are microdoses of minerals already found in the body. Safety disclaimer. Lactose. Intolerance. Most tissue salts are in a lactose base. Lactose-free sprays are available. Medical advice. Homeopathy and tissue salts are complementary. They do not replace emergency medical care or prescribe medication for serious conditions. Case management and specialized protocols. Hearing's law of cure goal. Learn how to distinguish between suppression, bad, and cure, good. In conventional medicine, the goal is often to make the symptom disappear. In homeopathy, how the symptom disappears matters. Constantine Herring formulated the law of cure, which states that healing must proceed in a specific order. The 4 directions of healing. 1. From above to below, symptoms should move down the body, e.g., arthritic pain moving from the neck down to the fingers is a good sign. 2. From within to without, symptoms should move from deep organs to superficial ones, e.g., asthma, lungs, improving, but a skin rash, skin appearing is a positive sign. 3. From more important to less important organs, e.g., heart palpitations stop, but you develop a mild stomach ache. 4. Reverse order of appearance. Old symptoms may briefly reappear as the body unwinds the disease history. Critical note: if a patient treats a skin rash with a steroid cream and immediately develops asthma, homeopathy views this as suppression, driving the disease deeper, violating the law of cure within to without. The Potency Selection Guide. Goal: demystify the numbers on the bottle, X versus C. Selecting the right strength is as important as the right remedy. The decimal scale, X, the physical builders. Notation, 3x, 6x, 12x. Dilution, 1:10 ratio. Primary use, tissue salts. Action: these act on the physiological, nutritional level. They build up the blood and cells. Frequency can be repeated often, 3 to 6 times daily. The centesimal scale, C, the energy shifters. Notation, 6C, 30C, 200C. Dilution, 1:100 ratio. Primary use, homeopathic remedies. Action: these act on the vital force, immune response. 30C, standard. The Goldilocks potency, safe for home use, strong enough for acute illness, gentle enough not to aggravate. 200C, high, used for intense acute situations, shock, high fever, or mental emotional states. Use with caution. Condition recommendations. Nutritional deficiency. 6X, tissue salt. Example, calc, Phos 6X for anemia. Acute injury, bruise, 30C, homeopathy. Example, arnica 30C immediately after fall. Chronic low energy, 6X or 12X, tissue salt. Example, Caliphos 6X daily for weeks. Sudden high fever, 30C or 200C, homeopathy. Example, belladonna 30C every 2 hours. Specialized protocols. Pediatric protocol, children and infants. Children respond very fast to homeopathy because their vital force is usually high and uncluttered. Teething, O tissue salt, calcophos, number 2, plus ferrum phos, number 4. Rub on gums or dissolve in water. O homeopathy, chamomilla 30C. Indication, one cheek red, one pale. Child is incredibly angry, irritable, and demands to be carried. Colic, O tissue salt, Mag-Phos, number 8, dissolved in warm water, the hot sip. O homeopathy, colocynthis 30C. Indication, baby pulls legs up to tummy in pain, better with pressure. Bedwetting, O tissue salt, Nat Phos, GR10, if due to acidity, worms, or Caliphos, Unit 6, if due to nervousness. Women's health protocol. Menstrual cramps, O magphos, there are 8, is the absolute specific for cramping pain. Morning sickness, O tissue salt, natphos, there are 10, for acid rising, plus calimur, there are 5, if tongue is white. O homeopathy, sepia 30C. Indication, smell of food causes nausea, feels indifferent to family, exhausted. Varicose veins, pregnancy, O tissue salt, calc fluor, number 1. This restores elasticity to the vein walls. Take for 3+ months. Remedy care and antidoting. Goal: ensure your remedies remain effective. Homeopathic remedies are energetic in nature and can be deactivated, antidoted, by strong vibrations or chemical signals. 1. The mint rule. Traditionally, it is advised to avoid strong mint flavors, toothpaste, gum, within 15 minutes of taking a remedy. Strong essential oils, camphor, eucalyptus, should also be kept away from the storage bottle. 2. Coffee. Some homeopaths believe strong black coffee antidotes remedies. If you drink coffee, keep it 1 hour apart from your dose. 3. Touch. Do not touch the pills with your hands. Oils from the skin can degrade the remedy on the pellet. Tip the pill into the cap, then drop it under the tongue. 4. Storage. Keep away from microwaves, X-ray machines, and prolonged direct sunlight. Capstone case study. Putting it all together. The scenario. A 35-year-old woman comes to you. She has been working 60-hour weeks for a month. Stress. She feels totally drained and has started getting headaches that shoot up her neck. She looks pale, and her temples look hollow. Yesterday, she got caught in the rain and now feels a fever coming on with a red face. Analysis. 1. Immediate acute. The fever. She was chilled, rain, and now has a red face, fever. This is the first stage of inflammation. Remedy. Ferrum phos, Natter 4, or Aconite 30C, homeopathic remedy for ailments from cold wind. 2. Underlying cause, the stress. She is drained and overworked. Remedy. Califos, number 6, the nerve nutrient. 3. The pain type, shooting pains. Remedy. Magphos, number 8. The protocol plan. Step 1. Take ferrum phos every 30 mins to stop the fever cold onset. Step 2. Once the fever breaks, begin a tonic of califos plus magphos 3 times daily to rebuild the nervous system and stop the tension headaches. Constitutional types and advanced combinations. Introduction to constitutional prescribing. Goal: recognize the soul of the remedy. In acute prescribing, Unit 8, we treat the immediate problem, e.g., arnica for a bruise. In constitutional prescribing, we look for a remedy that matches the patient's entire physical, mental, and emotional makeup. This is often used to treat chronic issues or boost overall immunity. Here are the big 4 constitutional archetypes you should recognize. 1. The Calcarea carbonica type, the archetype, the steady worker, the oyster. Physical. Often has a stocky, chubby, or flabby build. Prone to sweating on the head, especially babies during sleep. Cold hands and feet. Mental. Hard-working, practical, and reliable, but prone to deep anxiety about safety, security, and health. Fears going crazy or people observing their confusion. Cravings, eggs and indigestible things, dirt, chalk, in children. 2. The pulsatilla type, the archetype, the windflower. Physical, symptoms change constantly, shifting pains, prone to hormonal issues. Usually not thirsty, thirstless. Mental, mild, yielding, emotional, and weepy. They crave sympathy and feel much better when comforted, hugged. Often clings to the parent or partner. Keynote, better in open air. They feel stifled in warm, stuffy rooms. 3. The sulfur type, the archetype, the ragged philosopher. Physical, hot person. Kicks covers off at night, prone to skin issues, itchy, red, burning. Red lips and ear tips, unkempt appearance, messy hair. Mental, intellectual, theorizing, critical of others, can be lazy physically but mentally sharp, often disorganized. Keynote: worse with heat. 4. The lycopodium type. The archetype: the insecure boss. Physical: digestive issues are paramount, gas, bloating, heartburn. Issues often appear on the right side of the body. Mental: lacks self-confidence inside but covers it up with a haughty, dictatorial attitude outside. Afraid of public speaking, performing, but does well once started. Keynote: the 4 p.m. to 8 p.m. aggravation. Symptoms get worse in the late afternoon. The biochemic combinations, the BC numbers. Goal: decode the numbered bottles found in health food stores. While you can mix single tissue salts from Unit 3, manufacturers sell premixed formulas labeled BC1 through BC28. These are standard across almost all brands: Schwabe, Highlands, Dr. Reckeweg. BC Jaus, indication component salts, why it works. BC5 Coryza, cold and sinus. Ferrofos, inflammation. Pois, Calimur, congestion. Pois, Natmur, runny nose. Pois, Calisulf, resolution. BC6, cough, cold, and catarrh, focuses more on the chest and throat than the sinuses. Includes Magphos for spasmodic coughing. BC12, headache. Califos, stress, plus Natmur, thumping pain, plus Ferrofos, congestive throbbing. BC16, nervous exhaustion, the student's friend. Califos, plus Calcphos, plus Magphos. Excellent for burnout, exam stress, and anxiety. BC24, 5-phos. Tonic contains all 5-phosphate salts, the ultimate nerve and brain tonic. BC25, acidity and gas. Natphos, the acid neutralizer, plus Natsulf, liver support, plus Cilicia. BC28, general tonic, contains all 12 tissue salts, used for general debility, convalescence, or when symptoms are unclear. Unit 18, tongue diagnosis, the map of the mouth. Goal: use the tongue as a diagnostic tool for tissue salts. Schussler placed great emphasis on the coating and color of the tongue to determine which salt is lacking. 1. Clean, red tongue. O indication, ferrum phos, MER4. O meaning, acute inflammation, blood congestion. 2. White coating. O indication, Calimur, NER5. O meaning, sluggishness, congestion, fibrin buildup, second stage of illness. 3. Creamy, golden yellow coating, back of tongue. O indication, Natphos, NER10. O meaning, acid accumulation. 4. Slimy, brownish mustard coating. O indication, Calisulf, NER7. O meaning, deep-seated toxicity, need for oxygenation. 5. Frothy, bubbles on edges. O indication, Natmur, NER9. O meaning, water imbalance. 6. Cracked, map-like tongue. O indication, calc floor, NER1, or Cilicia, NER12. O meaning, tissue laxity or structural weakness. Building your holistic kit goal, a checklist for your home medicine cabinet. If you are building a kit from scratch, prioritize these items in this order. Tier 1, the essentials, start here. Arnica montana, 30C for all trauma injury. Ferrum phos, 6X for the start of any illness. Magphos, 6X for all pain, cramps. Califos, 6X for stress, sleep. Calendula cream, herbal homeopathic for open cuts and scrapes, antiseptic. Tier 2, the family kit, Apis mellifica, 30C, for bites, stings. Nux vomica, 30C, for tummy upsets, overindulgence. Cilicia, 6X, for splinters and infections. Biochemic combination, 5, BC5, for colds. Tier 3, the complete kit, full set of 12 tissue salts. Full set of 36 basic homeopathic remedies, often sold as the blue kit or similar by pharmacies.